Hello, and welcome to another episode of the RTI Health Advanced series on social determinants of health. My name is Denise Clayton, and I'm a health economist in RTI Health Advance, and I'm joined today by my colleague Lisa Lines, a senior health services researcher. Last time, we talked about current challenges with social determinants of health data and new approaches to incorporate better data to produce better health using the Local Social Inequity Score, or LSI. In today's episode, we'll be talking about some of the applications of the LSI. So to get us started, Lisa, can you tell us about some of the goals or applications of the LSI in terms of helping organizations account for social risk in value-based payment models?
Yeah, Denise, the local social inequity scores can be directly incorporated into a risk adjustment model that predicts healthcare expenditures. So this ties back to making sure that providers aren't punished for factors outside their control and that their payments accurately capture the risk factors their population is experiencing. And when you do that, you reduce the incentives of providers to cherry pick patients.
Yeah, thank you so much for sharing that. I think the great thing is that even though the LSI is at the neighborhood level, it can still be incorporated as a variable in an individual level risk adjustment model. So you don't have to make major changes to risk adjustment. You can simply add a new variable to an existing model. Say one that has, age, sex, and diagnoses, or HCCs. So I'm interested to hear more about some of the other applications related to identifying which interventions to implement and which patients or members are in need of those interventions.
Yeah, we think the LSI could be very useful for targeting interventions to higher risk populations and understanding the characteristics of higher risk populations. So, say you're working on a new intervention or support program for social determinants. How do you identify the people who need it and get it to them before they have a major health event? You can use the LSI to identify perhaps the top decile of the population at highest risk or the top percentile or the 99.5th percentile, and then focus on all the efforts on just those individuals at highest risk, living in higher risk communities, really. And I want to make sure that we say, I mean, just because we're risk adjusting for social determinants does not remove the obligation to address the social determinants. So, but I think that the artificially intelligent risk adjustment approach can be used to inform policies also to address root causes. So if you're a provider or a payer or a policymaker and you have a budget to address social determinants of health, how do you know what's the most important to address, Denise? I mean, food
Yep.
insecurity, housing insecurity, transportation, they all sound very important. But the neat part about our approach is that you can run the causal models to tease out the root causes, which you can use then to help guide decision making about where to invest and what to address, and getting more bang for the buck, really.
Yeah, that's so important. And, we often talk to payers and hear about the fact that they want to obviously implement all these new programs, but they also want to evaluate them and understand what's working and what's not and why. And I like that the LSI has a role in evaluation as well. So, thinking about evaluating a social determinant of health program or in thinking about evaluating some other program but wanting to control for social risk factors, that's another application where the LSI comes into play. So if you're like me, sometimes living in a world of trying to identify the causal effect of an intervention where a randomized trial didn't happen, having a good control variable or variables that help you with matching to create the best comparison group, those are tools, those variables help you improve the approach to quantify the effects of whatever you're trying to measure. So you get the best estimate possible about what the true causal effect is. So it can be used in evaluation of a non-SDoH program and be a control for SDoH, or it could be used in an evaluation of an actual SDoH program as well directly.
And
So I
the
think that's
analysts
really neat.
people don't have to decide amongst a very, number of different SDOH variables and try and deal with collinearity and all the
Exactly.
things that happen when you have the multiple social determinants variables going in. Having one single composite measure is really useful for evaluation.
That's a great point. And I like too that the LSI can be at different levels. So if you're doing an evaluation at the individual level and you've got, zip code level data to merge in the LSI, you can do that. Or if you've only got county, you can merge it in that way. Really, it's quite flexible because of the different level of granularities that it has. All right. Well, thank you so much, Lisa, for talking with me today. I think these applications have a lot of potential to improve health and health equity. And thanks to all the listeners for joining us for this discussion. Please stay tuned for more episodes in our Social Determinants of Health series. If you'd like to learn more, you can connect with us at rtihealthadvance.org. We're happy to talk with you further.